So today I'd like to talk about some important information you need if you're considering a Brazilian butt lift. So the first question is, how do I know if I'm a good candidate for a BBL? So generally speaking, you need to be healthy, in good physical shape, have enough fat to remove from one place and move it into the buttocks, obviously, and be willing to undergo the recovery process from the procedure, which is not insignificant. Essentially, you need to stay off the buttocks for somewhere around 6 weeks. The more you sit on it, the less the fat will take. So then other questions are, what's the difference between a Brazilian butt lift and Brazilian implants into the buttocks? So the implants are artificial material, the same way breast implants would be. The Brazilian butt lift removes your own fat and then transmits it into the buttocks like a graft would be. So we're taking living tissue, your fat, and moving it into the buttocks where it's getting a new blood supply and thriving into the new space. So it will react the same way your normal fat does. If you gain weight, it'll get bigger, and if you lose weight, it'll get smaller. That's the good and the bad of the Brazilian butt lift. Question everybody asks is it safe? So like every procedure, there are some risks involved, but if done properly in the right setting and in the right patients, the procedure can be done very safely. Another question the patient asks is it permanent? The results from the Brazilian butt lift will be long-term. So we'll put some fat into the buttocks. Roughly half of it will be absorbed by the body just from the transmission process. But the other half will stay. And the half that stays will be there pretty much for the rest of your life. That fat will get a new blood supply and live and thrive the same way your current fat does. Patients will often ask, should I gain a few pounds before a Brazilian butt lift? I think I like to have you around your normal weight. If you gain some weight and then you're going to lose it again, that fat will reabsorb the same way it would if you lost weight anyway. So the ideal candidate is someone who wants their buttocks enhanced, who has a little bit of extra fat here or there, most commonly the stomach, the love handles, the back, inner thighs. We can remove that fat, shape the body better just from the liposuction, and then enhance the buttocks at the same time. For more details, the best thing to do is come in, and I'm happy to sit down with you for a consultation, and we can go through things in a lot more detail.